Is my
Yes.
screen visible?
Yes,
Okay.
yes, yes.
Okay. Thank you, everyone. Thank you for
Yes, it
your
is.
answers. Actually, now I am going to take you out a bit from the microbiology lab. I am a medical doctor by profession, but currently I am doing my PhD in domain of public health epidemiology, and I'll be presenting on the topic spatiotemporal epidemiology and forecasting of dengue in the state of Punjab, India. The paper was published somewhere in July, and those who are interested can go through the DOI for further details. Now, we all are aware that dengue is a public health problem, and Southeast Asian region is one of the regions across the globe contributing maximum to it. When we talk about India per se, India is a vast country and it has various states, and health is a state subject. So, looking at the distribution of dengue in the country, what we realize is that the state of Punjab, India, is having quite a high burden from 2015, and we need to undertake measures to control and prevent it. If we try to look at the natural history of the disease or the dengue epidemiology per se, so what we realize is that there are many factors which are playing role in causation of dengue. The environmental factors, climatic factors, play a role in development of the vector or the mosquito per se in during the life cycle of development, or whether it's related to the survival of the mosquito, or whether the mosquito will be able to become infective or not. And thus all these climatic, environmental and other factors play a role, and if we can harness and understand those factors or the dynamics of natural history of dengue, then we'll be able to do something to control it. Now, using routine data, or one approach is to undertake some knowledge driven models, such as we have seen SIR models or SCIR models for COVID, or we have data driven models. But at the same time, it's very important to understand that the routine administration, the routine public health system is capturing data. This data can be utilized to understand the dynamics, to gather insights, to develop some knowledge and wisdom if possible. Public health surveillance aims at providing information at timely interval. So what is this timely interval? This timely interval we can define as an interval which gives us a lead time. Take for example, a public health manager is sitting at varied level or at a state level. It will be quite beneficial for that public health professional to know if there is a surge in the number of cases in the coming months. Similarly, if that person is able to find out that in the area of responsibility or in the entire state, which district is going to have high number of cases. And for the district level manager, if we can tell which is the sub district where these cases are going to rise, the resource allocation in terms of manpower or money or any resources can be channeled in a much effective manner. Traditionally, we are based on passive reporting, or once we come to know that okay, the number of cases have increased, we start taking action. But the forecasting based or data science approach enables us to develop some proactive systems, and the same has been recommended by WHO and by varied organizations. So the goal of the present study is to determine mechanisms wherein we can harness this routine healthcare surveillance data and combine it with data sets from non-health sectors to develop understandings and develop a decision support system for dengue surveillance. So the objectives of the study are to describe the spatiotemporal, that is in space where the disease is occurring and in time when it is occurring, of not only dengue but its associated risk factors also in the state. To explore the associations which are occurring between the disease occurrence and the risk factors, and to see whether it is feasible to develop a forecasting model based on the same, and if so, whether a decision support system can be made. The same was taken up as my own PhD project, and now we have moved ahead from the protocol, and we are seeing some promising results. Trying to understand where we did the study, if we look at the world map, India is a country in Southeast Asian region, and in that Southeast Asian region country, Punjab is a northern state in the country with around 150 sub districts. The present study is an ecological study and uses a data science approach. For that, we collected data from National Vector-Borne Disease Control Program of the state, and we found that around 66,000 cases were reported over a period of last 5 years from the state. So we collected data from not only the source I'll be covering subsequently, but once the data was collected, we found that routine data is never meant for research purposes. It's mainly focused for routine administration and prevention and control measures. So we collected the data, extracted and curated or pre-processed the data to a research level data set, undertook a exploratory data analysis, and subsequently developed some dengue forecasting models to develop a framework for routine data-based vector-borne disease control programs. The other data sources which we used apart from National Vector-Borne Disease Control Program included satellite imagery data from MERA-2, Global Precipitation Mission, MODIS satellite imagery data. Now, trying to understand, once we have dengue occurrence, it can be defined as a suspected case. Any person coming with fever is suspected to be of dengue with some clinical characteristics. Once that lab test is performed, whether it's based on ELISA testing or whether it's a rapid testing kit, a person is diagnosed as a lab confirmed case. This lab confirmed case routinely gets reported in the state to the state health authorities in form of a line list. That line list has two important dimensions. One is time and second is space. In terms of time, it is the date where the onset or the disease occurred. And second is the addresses where the individual is residing. Using those addresses, we used Google geocoding API services and geocoded those addresses. For MERA-2, or it's a global climatic model data, we used API services from NASA PAR, which is a NASA initiative, and extracted data at around 50 kilometers resolution for daily variables such as temperature at 2 meters, temperature at 10 meters, wind speed, humidity, precipitation, and so on and so forth. For precipitation, Global Precipitation Mission provides data at around 10 kilometers resolution that was captured. And then to get the denominators, projected populations were calculated from census 2011. Also, since environmental factors such as the vegetation in a given area at a given time is important for the disease occurrence, we took OCM2 or Bhuvan meteorological data for the country. The spatial datasets were taken from Punjab Remote Sensing Center, Ludhiana, in the state. Once the data was curated and made into a tidy format or a research level format, exploratory analysis was carried out, which included calculation of basic statistics and exploratory spatial and time series analysis. Exploratory spatial analysis includes varied visualization. The data was churned into varied forms to make some choropleth maps to calculate global estimates of spatial clustering, because dengue or infectious disease usually occur in clusters. So whether clustering is present or not, that global clustering estimates were done using Moran's I statistical estimates. Also, time series graphics in terms of autocorrelation or cross correlation functions were carried out. Further, for model building and to identify which variables should be taken up further for development of forecasting models, we carried out correlation analysis and some basic analysis to fulfill the assumptions for forecasting models. Also, disease mapping in form of standardized incidence rates were carried out. The spatiotemporal analysis further went into local estimates of spatial clusters. On exploratory analysis, once we find that there is a clustering happening in the state or the disease is clustered, to identify where exactly that cluster is, these local estimates are helpful as a statistical measures. Also, emerging hotspot analysis, meaning to say that every month, if we are having clusters, are these clusters consistent over a period of time? Are they increasing? Are they decreasing? Are they what are the dynamics in the disease which are happening? Also generalized, because disease occurrence and climatic associations are not linear in nature. We cannot go for multiple linear regression models or models where assumption of linearity is not fulfilled. So, being count data, dengue occurrence data, initially generalized mixed models, putting a random effect for health system effectiveness was made, and subsequently generalized additive mixed models with the piecewise polynomial fits were tried. Also, hierarchical time series analysis has been carried out as a health manager is interested not only for the disease occurrence at the state level but also at the district and sub-district level. So we have hierarchies or levels, multi-level modeling needs to be carried out. For machine learning purposes, the data from 2015 to 2018 was used to develop to train the computational models for as training data, and 2019 datasets has been used for testing with how effective these models perform for forecasting. Model diagnostics in terms of residual analysis, looking at spatial autocorrelation in the residuals or uh, temporal autocorrelations was carried out. The entire analysis has been carried out in a reproducible manner from the phase of data collection till the final results is open source. Free solution in our software has been carried out. A few data extraction algorithms have been prepared in using Python, and some visualizations using QGIS or Quantum GIS. All of these, even Quantum GIS codes, have been made in R Markdown. Various cutting edge latest R libraries such as Tidyverse and SIF and FPP3 packages have been used for modeling MGCV package for generalized additive models. Necessary clearances, permissions were taken for the study. The study has been registered as a PhD proposal for self, and I'm working on it. The data privacy and confidentiality has also been maintained. So, being the current presentation as the study protocol, so this is what we proposed and we have been carrying out. I won't be sharing the results right now because of the clauses of dissemination of thesis with me right now. But we expect that the exercise which we have carried out or the project which we have carried out provides a value addition to the existing surveillance systems. The data gets collected, the data gets stored. It's high time in low and middle income countries that we start utilizing those data sets. If we don't, then the issues such as data quality cannot be identified, and that's the path which developed world or the countries have used for eliminating malaria, dengue, vector-borne diseases, and many other infectious diseases, and has been successful. And the present study is novel in its nature, being from the country where first time satellite imagery data is getting linked with the routine health system data in the state. Also, the project provides insights as to how we can strengthen surveillance using not only this routine data but integrating multiple data sources from non-health sectors. It's interesting to know that one of the challenges, like climatic and environmental factors, they are quite important in disease occurrence. But looking at the on-ground meteorological stations, they are sparse not only in space but also in time. These remote sensing satellite imagery provides an alternate resource to capture those data and develop such kind of models. Data science, epidemiology, and routine data sets. As I said, it has opportunity, but the challenges are numerous. Linking in data linkages between different systems always require a unique ID or some relational database functions. Those are the biggest challenges. Data quality is another big challenge. Use of research level satellite imagery is another aspect which we need to understand, because being a doctor or being from a medical professional, these satellite imageries are faced with noise in terms of they have sensors. So if the cloud cover is not good, the sensor is unable to pick up well. Being from this domain of medicine, I cannot equip myself to develop and curate those raw data sets and make research level data sets. But with help of people from and professionals from other branches such as geography or remote sensing, such collaborations are possible. Spatiotemporal approach and public health systems I have discussed. Though there are strengths, there are some limitations also. We have not been able to capture many other aspects like movement of the people or health system indicators like how is the effectiveness of the health system in a particular sub district. We have tried putting a mixed model or random effects to it, but still, if those data sets get captured, a better models can be made. I would like to acknowledge Pride Conferences for giving me this opportunity. Dr. Biju Soman, who is my guide for the current project, Dr. Manoj Kumar TK, Dr. Jimon P, Dr. Sijulan Nelson Sati, Dr. Shrikante, who are my co-guides and mentors, Dr. Gagandeep Singh Grover, who is the State Project Officer of Directorate of Health Services Punjab and who agreed on the current project and is enabling us to institutionalize these findings into the health system. And Dr. Arun Mitra P, who is a colleague of mine, but actually working a lot with myself and giving valuable insights into the project. Thank you, and I'm open for questions.
Thank you so much. Do you have any questions? No. I think that your methodology is very important to improve the knowledge of dengue illness or for other illness, other disease. Do you think that the methodology you used can be applied for other disease caused by different vectors?
Yes, it can be. See, the strongest point I'll say, or the biggest strength of the current project is that it has been carried out in our environment. So it's reproducible. It can be applied not only to other diseases but to other states in the country also, and to similar demography conditions for other countries also. Also, it's scalable. Like one of the limitation I mentioned is the lack of availability of health system data with me right now. But if we get that, the current models which we are preparing can have additional covariates or independent variables. So that way, yes, it can be applied to other diseases and to other states or locations also with modifications.
Gurpreet Singh, sir. I have
Okay.
one more.
Yes,
Gurpreet Singh, sir.
yes.
Uh-huh.
When the respondents, when you are go for the research, when you find the heterogeneous environment, how can you say that we can go ahead with the same method of research?
So see, the thing is the data science approach. The data science approach starts with a collection and exploratory analysis. So just to share, we found that lag of 2 months of temperature humidity in the state is associated or related maximum to the dengue incidence in the state. Now, this particular finding applies to this state, but this method can be applied to other state or other locations, and that particular lag can be identified. Second, now when we are preparing these piecewise polynomials, there is something known as knots, or how many pieces we need to develop so that we can get a smooth temperature linearly associated with dengue occurrence. So that knots may vary, but the underlying principles and the concepts will not. So that was the rationale behind saying that it can be applied to other states and locations also.
Thank you, sir. Thank you so
I hope I
much.
am able to justify.
Yes, yes.
Thank you.
Thank you so much again.